Welcome all of you my YouTube channel. This video I am going to talking about encephalitis. First of all, if you are not yet subscribed my channel, please subscribe it. If you have any questions, please leave a comment. Encephalitis is an acute inflammation of the brain, typically caused by a viral infection. It can lead to severe neurological complications and is considered a medical emergency. The condition can affect anyone, but certain populations, such as young children, the elderly, and immunocompromised individuals, are at higher risk. Causes: encephalitis is most commonly caused by viral infections. Common viruses that can lead to encephalitis include 1. Herpes simplex virus HSV. HSV1 is the most common cause of severe viral encephalitis in adults. 2. Arboviruses. These are transmitted by insect bites, such as West Nile virus, Eastern equine encephalitis virus, and Zika virus. 3. Enteroviruses, including poliovirus and Coxsackie virus. 4. Rabies virus, typically following a bite from an infected animal. 5. Childhood viruses, such as measles, mumps and rubella, though these are rare causes due to widespread vaccination. Other infectious agents like bacteria, fungi, and parasites can also cause encephalitis, but these are less common. Symptoms: the symptoms of encephalitis can range from mild to severe and may develop rapidly or gradually. Common symptoms include fever, headache, confusion or altered mental state, seizures, loss of consciousness, weakness, or partial paralysis in certain parts of the body. Sensory changes, such as photophobia, sensitivity to light, or phonophobia, sensitivity to sound, nausea and vomiting, stiff neck, in infants and young children. Diagnosis: diagnosis of encephalitis typically involves a combination of clinical evaluation and diagnostic tests, including 1. Lumbar puncture, to analyze cerebrospinal fluid CSF4 signs of infection. 2. Neuroimaging, MRI with CT scans to detect brain inflammation and other abnormalities. 3. Electroencephalogram to assess electrical activity in the brain, which can be abnormal in encephalitis. 4. Blood tests, to identify viral, bacterial, or other infections. 5. Polymerase chain reaction PCR testing, to detect viral DNA or RNA in the CSF or blood. Treatment: treatment of encephalitis depends on the underlying cause but often includes 1. Antiviral medications for viral causes, such as acyclovir for HSV. 3. Supportive care, including hospitalization, intravenous fluids, anti-inflammatory drugs, and medications to control seizures. 3. Antibiotics or antifungal medications, if the encephalitis is caused by bacterial or fungal infections. 4. Immunotherapies, in cases of autoimmune encephalitis, treatments may include steroids, immunoglobulins, or plasmapheresis. Prognosis: the prognosis for encephalitis varies widely and depends on several factors, including the patient's age, the causative agent, and the promptness of treatment. While some individuals may recover fully, others can experience long-term neurological deficits, such as memory problems, personality changes, or chronic seizures. Severe cases can lead to coma or death. Prevention: preventing encephalitis involves measures such as 1. Vaccination against common viruses like measles, mumps, rubella, and Japanese encephalitis. To avoiding insect bites, using insect repellent, wearing protective clothing, and avoiding areas with high mosquito activity. 3. Good hygiene, hand washing and avoiding contact with infected individuals. For animal vaccination and control, for diseases like rabies. Epidemiology. The incidence of encephalitis varies globally, influenced by factors like geography, season, and the presence of vectors like mosquitoes and ticks. Some forms like HSV encephalitis occur sporadically, while others, like Japanese encephalitis, are more common in certain endemic regions. Encephalitis remains a significant global health concern due to its potential for severe outcomes and the challenges associated with its diagnosis and management. Research continues to focus on better understanding its pathophysiology, improving diagnostic tools, and developing effective treatments and preventive measures.